Hello, my name is Inez Ruiz. I am an MPP candidate for this year 2016. I wanted to take this opportunity to go through my portfolio as well as summarize my experience during my time within the Masters of Public Policy program. To begin, the Masters of Public Policy program was something I wanted to get involved with in order to understand the key concepts in the field of public policy. Through building the portfolio on the website, I was confident that I do have a good set of manuscripts and research papers and summaries that can be used in the future, whether it's as an illustration of my background and experience, and I'm confident that I will be able to use the documents moving forward. I've also been able to engage with students and professors within my courses in the program. The back and forth with the students and the different types of students that are in the program. It's very interesting to see the ones that are working within the government programs validating a lot of the theories and topics and issues that we're learning about, as well as the professors who challenged me and really got to know my work and where I was coming from. And I greatly appreciate the professors and their engagement with the work that I do and the work that I was providing. I also was the reason why I wanted to begin this program was because I wanted to marry the topics of healthcare and public policy within my career. So basically, I've been in healthcare for many years now, and through the years, I've gotten to see, also through my education, I've gotten to see how the public policy, the federal government, the state government has an effect within the healthcare system here in the country. And within my current role, I am hoping to use the skill set that I've attained from this program to grow further and in the organization and to advance my career. So in particular, public policy in the healthcare field has really, within the past, I think it's maybe 10 years, within the past decade, I think has, or maybe 8 years, it's through Obama's administration actually. He's implemented the Affordable Care Act, and that has really pushed our country to try to adopt value-based care as opposed to fee-for-service care. So these changes within the federal government are trickling down to providers, to healthcare systems, to patients, and everyone's involved with how this change is gonna come to fruition and what the results are gonna be. So at the beginning, the Medicare Shared Savings Program was something that all of the providers were focusing on, ultimately because there's going to be a bundle of shared savings that would have to be dispersed to the different providers depending on who provides care for a patient. So if there's a certain amount of money, there has to be a designation for who is going to be receiving that reimbursement. At this point in the timeline of things, for example, in my organization, there is no set standard or guideline for how those reimbursements are going to be dispersed. There's still opportunity there to figure out how this is going to happen. And many of the physicians are interested in this, obviously, because in some areas they are losing reimbursements, but this is going to be one of the areas where they're gaining, and they're very concerned about who's going to be the person, who's going to be the providers to receive these funds. So definitely there's an opportunity here. Also, CMS, the Center for Medicare and Medicaid Services, has enacted this new Medicare Access and CHIP Reauthorization Act, which is a different program under which providers and healthcare organizations can again see savings bundles and receive reimbursements. What it seems that the Center for Medicaid and Medicare and Medicaid Services is doing is allowing an opportunity for the providers and healthcare organizations that haven't gotten involved yet with the value-based care, with the move to value-based care. This new act will allow these